So I want to introduce our distinguished panelists tonight. Evelyn Salama is a graduate of SUNY Downstate with a master's in OT, occupational therapy, and a specialization in early intervention. She has a private practice, but also sees kids at the Sephardic Center preschool through early intervention and CPSE. Evelyn has experience with kids who have developmental delays, ADHD, sensory processing disorder, autism spectrum disorders, executive functioning difficulties, and visual and fine motor issues. Evelyn also has worked in hand therapy. She has a deep interest in anatomy and how the structures work and the underlying reasons why they might not be working. That's what drives her work. Her approach to therapy is to question why a child can't perform and then analyze what to do about it. Laura Kurtz, MS, a master's in speech and language pathology, TSSLD. There's a lot of letters there. She is a speech and language pathologist, mom of 4. She's worked for many years treating children with a wide range of speech delays and disabilities, both in community schools and privately. Laura is the author of At Play to Speak on Instagram, where she writes about using everyday routines and play sessions to identify quality opportunities for parents to assist their child's language development. Laura runs parent workshops for kids from age birth to age 3, where she provides parents with tools and strategies to grab onto opportunities and realize that those everyday teachable moments. This helps parents effectively navigate and nurture their child's language to set them on the path for successful communication and language skills. Renee Zarif, PT, DPT, is a physical therapist serving both adults and kids for the last 7 years. She has worked closely with patients of varying needs, including orthopedic, neurologic, and pediatric diagnoses. Renee is passionate about helping individuals with physical ailments reach their goals using her knowledge base of exercise science and medicine. Renee takes special interest in helping those with neurological conditions, especially children who present with developmental delays. She has worked closely with children in private, yeshiva, and public school settings. And now I'm going to hand it off to our distinguished panelists.
Thank you so much, Miriam. I thank you for introducing me. So as everybody knows now, that I've worked in occupational therapy for the past 10 years in a few different settings. But ultimately, I chose to settle on young children because I feel that that's where I can affect the most change and give the children tools they need to grow into the best person that they can be. So for those of you who aren't so familiar with OT, I just wanted to give a little bit of an explanation. It's a little bit of a strange name. Occupation really refers to your job. So basically for a child, their job is play or school. So basically I am here to make sure that they are functioning at their best in anything that involves their daily living. Yes, I know that a lot of you know that I work on fine motor skills, I work on handwriting and cutting, but I also focus a lot, like Miriam said, on vision, on executive functioning, on sensory processing disorder, and also that we could analyze and make sure that that child has everything that they need to function at their utmost capacity.
Hi, everyone. As Miriam told you, I'm Laura Kurtz. I'm a speech language pathologist. I have been working with children in the community, both in yeshivas and privately for the last 12 years. And I also run parent workshops where I teach parents how to nurture their children's language from early on. I want to explain a little bit about, speech and language. When you hear of a speech therapist, many people think of just how a child talks, how someone speaks. So their articulation, their voice, stuttering, but there's a whole nother component, the language aspect. And with the language, we focus on pragmatic and play skills, auditory processing, ADHD, reading and writing. And there's so many things that are involved in, speech and language therapy. And I really love to see how the children progress. And I really, although I work with a wide range of children, I work with a wide range of disabilities and delays, I really love working with the younger children. And I love getting in there from early on and seeing how they progress and all the progress they make over the years.
Hi, everyone. I'm Renee Zarif. I'm a physical therapist. I'm so excited to be with you guys tonight. Thank you, Miriam, for that really nice introduction for all of us. So like Miriam said, I've been practicing for around 7 years now, servicing adults and children in the community. I got most of my training in the beginning, treating adults with neurological presentations and diagnoses. And soon after that, I started treating children. And when I started treating children, I realized how much the neurological concepts that I was applying to my adults overlapped with the treatments that I was applying to my children. Just because the way that children develop overlaps so much with brain development that the neurological concepts are actually pretty similar for adults and children. So much of what I was doing was kind of the same, just one was games and one is more exercise based. So over the years, working with children, again, like Evelyn was saying about OT and Laura was saying about speech, I feel like when you think about physical therapy, you really just think about exercise. And a lot of what I do with children is exercise, but it's a little bit more creative because everything is in game form. So I spend a lot of times working with them on things like running, jumping, core activation, strengthening. But then there's also other components like balance, proprioception, spatial awareness, motor planning, things that are not so obvious to physical therapy that I still work on with children. And I really feel like over the years, doing these things with children has shown me how important it is for their development. And I'm just very happy to have the opportunity to do that with them. It's very special.
So we are very excited to be here with you. We really want to focus on teaching you how to navigate these early years. Now, when you think of your children in the birth to 5 range, those years can be very challenging. And so much of what we do as therapists focuses on the development of children in that age range, specifically the 0 to 3 range, which is considered early intervention. A lot of what we do focuses on the collaboration between the therapist and the parent. And everything that we do focuses on the development, on your child's development from early on and how to incorporate it into their day-to-day activities. And everything that you do at that age is done in the home because that's where your child spends most of their time. And it's done with collaboration, through collaboration with parents, because parents are the ones who are with their children the most, especially at that age. You know, sometimes your child 2, 3 years old, and even younger, if they're in daycare, they'll be in school. So that's also a perfect opportunity to work with the parents or the teachers and incorporate their day-to-day activities and routines into their goals and into just everything that they do. We want to help your children strive to meet their goals in the most efficient way possible. Renee is going to also talk a little bit about, the 3 to 5 range to give a little bit more background.
So basically, once the child gets a little bit older and they're, let's say, in like the 3, 4, 5-year-old age range, now majority of their time is spent in school or playgroup or preschool setting. So at this point, once a child is getting services, it's more school-based. So when you hear of someone, a child needing school-based therapy, it basically means that the provider is coming into the school setting to give them those services. And the reason we do this is because they're spending most of their time in school. So when you hear of related services, what does that actually mean? So that can refer to PT, OT, or speech, or it can refer to all of them depending on what that child is getting. And basically what the therapist does is that they come into the school setting, assess the child in the school setting, and then they can make a treatment plan based on what they see. So the question is, why do I need to come into the school setting to see this? What's the benefit of it? So children can get services in school, they can get it at home, or they can get it in an outpatient setting, in a gym, in a center. But the real benefit of having it in the school setting is that when we come in and we can see the child in their setting, we can really get a very in-depth assessment of what's going on. So if we can actually see them in the classroom with their teachers, with their peers, going, from the classroom to recess to the lunchroom, up and down the stairs, doing those transitions, we can really get a better idea of how they're actually performing versus if we were in an outpatient setting and, mom or a teacher was telling us, oh, this is how the child is presenting, it's a little bit different for us to see with our own eyes and to be able to get that full picture of the child in their setting.
I completely agree. So like in the school, we have the opportunity to collaborate with teachers, with the other therapists, and then of course with the parents through phone calls and things, but it helps us to target these underlying components to address the delay. So for example, a child's not jumping rope, why not? They're not cutting, or for Laura, like they're mumbling or not articulating their words. All of these things, yes, they probably have underlying issues with strength for sure, but also could there be some vision and spatial awareness component to it with jumping rope and cutting, or an oral motor strength and coordination issues with the mumbling? So seeing them in the classroom really gives us a deeper understanding of what's going on with the child. Take let's say cutting again for an example. I can either get a report that the child can't cut, and so I can go work on that outside in the class, in my classroom somewhere else. But if I'm with the child in the classroom, I can look and see why. Can they go find the scissors? What about the paper? How are they navigating the furniture in the room? What about the friends? If someone calls his name, did he hear it? Can he filter out the background noise appropriately to focus on the task at hand? So really, and another piece that we see is sometimes when we do pull the child out, they're fully capable of doing all of those things. But when you're in the classroom setting, those pieces are really overwhelmingly make things really, really difficult for the child to function. And so it's very different for the child to be in a 15 or 25 person classroom environment than it is for them to be in a one-on-one setting.
So why is it that we're discussing all of these things? When you look at a child as a parent, as a mother, even when your child is in the school setting as a teacher, little concerns could arise, right? It could be something so small, you're not sure if it's something to be worried about, you're not sure if it should be a concern. And at that point, that's the time to seek out advice. You can go speak to a therapist, you can go speak to your pediatrician, speak to Search. There's a lot of people out there who can help you. And if something isn't sitting right with you or with the teacher, that's the time to go ahead, get your child evaluated, and see what's happening. So we want to highlight, we're going to give you guys a case study that's fictional, but what we want to do is highlight different concerns that might come up, and they might not seem so obvious when you're looking at one little thing, but when you look at it as a whole, there might be something underlying going on. And we actually want to give you guys some insight as to how each of us would look at it and think about it from within our domain, from our point of view.
Evelyn's muted.
Okay, 1 second, Evelyn.
And Evelyn needs to start the case.
Sorry, that was my fault, everybody. Okay. So for our case, we came up with a boy. I think Laura just mentioned it, but I was very focused on getting unmuted. He's basically people that we see all the time, children that we see all the time. So Billy is a 4-year-old boy in a mainstream yeshiva. He's born in March. He is in nursery. He loves playing with trains and cars and blocks. And his parents say that he's always making cute roadways and playing pretend with the figurines and the animals. And he's very imaginative, and he gets his stuffed animals, and he makes different little voices for all of them. He builds all the roadways, but they do note that he never really chooses to build towers or more elaborate structures. So that for me, that's something I want to keep an eye on.
So in terms of his extracurricular activities, he's part of a softball league after school once a week. His mom says that a lot of times he really doesn't want to go. He avoids putting on his uniform, tells her that he'd rather stay home. And she's decided to speak to the coach about this. And the coach actually said that he is actually having trouble keeping up with the other children on the team. she was very insistent to keep him on the team because she wants him to build his skills, and she wants him to be on a team with his friends, and she just feels like it's very important for him physically and socially. So she still wants him to stay on the team. When speaking to Billy's teacher, she says that he's very friendly. He's oftentimes playing with children that are building towers and playing with the blocks and the trees in the classroom. But she does notice that sometimes Billy will run into the towers and knock them down. He'll sometimes run into his friends and knock them down. And then his friends get really upset, and then he's really frustrated, and it's just like a very big commotion, and he can't really express how he feels in the moment. It's very hard for him to kind of verbalize his emotions when that happens.
So Billy also has difficulty with transition. So he has trouble going from activity to activity or from room to room. And he especially has difficulty when they go to recess, when they go to the yard, going up and down the stairs. And the teacher needs to give him a lot of verbal cues to go ahead with the class. And he really lags behind a lot. So in the classroom also during circle time, the teacher mentioned that he likes to lean on things. He has a very, very hard time just sitting still. He likes to lean on a chair, or he'll lean on a bookshelf. He has difficulty, just focusing on the story when the teacher is reading a story. He can't answer WH questions when she asks them after reading a story. He's easily distracted. But the teacher knows that he understands what's going on, because when they do follow-up projects afterwards, he understands the content. So something's not sitting right.
So this would be a typical case that we would see. And now we're just going to each show it to you in our own perspectives based on our disciplines. And we're going to give you a little bit of insight as to what we would look for more in depth after getting this information. So the first thing I would look for in terms of physical therapy for Billy, based on what I just heard, is I want to look at what's going on when he sits in a circle, right? So again, this is like an example of being in the classroom setting and getting an idea of what's going on. I would watch him during circle time and see, why is he leaning on things? Is it posture related? Is it related to maybe his core not activating the right way? I would want to take a look at that. And then in terms of soft, his mom's reporting about, the way that he's playing with the team, why is he having trouble keeping up with the other boys that are his age? He is born in March. He's pretty much in a mainstream classroom. So what am I really looking for here? Is he having trouble running? Is he having trouble going from base to base, motor planning? Maybe it's a hand-eye coordination with the ball. Maybe it's crossing midline. There's so much rotation that's involved in that kind of sport. So is he able to achieve that rotation? Is something going on with that? And then again, the crashing with the towers. I'm also wondering, why is he running into the towers? Why is he running into the kids? He's 4 years old. He's a little bit older at this point to kind of distinguish where things are in space. So is that a spatial awareness problem? Spatial awareness, like, just quickly means that, knowing where his body is in space. So does he not have an idea of where he is in relationship to where the blocks are, to where his friends are? And then finally, a very big one with school is going up and down the stairs, of making those classroom transitions. Does he not have the strength to go up and down the stairs? Does he have trouble coordinating his steps? These are things that I would want to take a closer look at.
That's a lot of the things that Renee is looking at. I'm also looking at as OT. A lot of the strength pieces, the coordination, is it a crossing midline issue? I would also look at, he's having a hard time building towers. He's having a hard time in the baseball league. Is it strength? Is it a visual perceptual issue that he's having trouble like stacking one on top of the next? Is there a core strength piece, right? He's also not able to sit during circle time. So that could be part of the reason that he's leaning on the bookcases, having trouble playing sports like running, swinging his bat. He's also breaking kids' towers and crashing into things. He's bumping into kids while he's in line. It could be accidental because he doesn't have good proprioceptive and vestibular processing skills. It could be that he's seeking sensory inputs, or it could be behavioral. So these are all things I want to take a further look at.
So as the speech therapist, I would also want to look at the child both in and outside of the classroom. So first of all, his inability to really express himself so well when he gets frustrated, I would want to see, I would need to speak to Evelyn and make sure that the environment is not overstimulating for him, because sometimes when the environment is overstimulating, kids shut down. And even though they have the ability to express themselves, they can't when they're overstimulated. His poor intelligibility, his clarity, I would need to assess his articulation or his phonological processes. Are they age appropriate? His difficulty with answering WH question. So we would have to look at his memory skills, his ability to focus, his attention, his difficulty with transition. This is something that I would need to speak to Renee about also. This is how our domains overlap. So if there's a gross motor component going on, that's where Renee would come in. Otherwise, it could be behavioral, or it could be something where he has difficulty following directions. Even knocking other people's towers down. That's another thing that could be behavioral, or there could be an underlying social component to it.
So these are the things that we would look for in our own fields, but I really feel like even after talking about this together, you can see that there's so many things that overlap. So of course, we're looking for specific things that apply to PT, OT, and speech, but overall, so much of what we're looking at overlaps. And this is what we want to highlight and what we want to bring to everyone's attention about the importance of the school-based setting and having that ability to collaborate with everyone across the board. And the nice thing about this is that we really do get the chance to look at Billy as a full child. We take so many different aspects about what we see, and we're able to work together to really be able to help him reach his full developmental potential. And I think that's one of the most special things about what we do, is that we can really come together and bring all that knowledge to help him reach his full potential. So it's not just about going up and down the stairs or the mumbling or, the proprioceptive issues that he's having, let's say with knocking down the towers, but it's putting all of that together to make it one full picture and to help him reach the full potential that he has as he's developing in school.
Exactly. So Billy isn't real. We see components of Billy in all the kids that we see, but we wanted to give you an idea of this, and we want to give you an idea of what it might look like, let's say in 5 years from now, if Billy didn't have therapy. Some children will outgrow it on their own, but a lot won't. So instead of waiting and watching and seeing and waiting to see if Billy's going to grow out of it, it's better to take care of it before it becomes a larger issue that affects him in multiple areas of his life, right? So as an OT, he couldn't build towers, and maybe he wasn't able to do puzzles, as I assessed him further. But now maybe he's having some issues with visual scanning, reading, and decoding in the classroom when he's older, or he was having some trouble coloring and cutting. That was from a decreased fine motor strength. It could lead to decreased ability to take notes, and also the decreased ability to copy. So these are things that when they're young, it's not such a big deal, or so you think. It's not such a big deal. He's not coloring inside the lines, or he's not being able to make patterns properly. But those are things that eventually lead to bigger things. If we don't address his sensory issues now, they could prevent him from being able to focus in the future. If he's constantly fidgeting and constantly seeking certain inputs, he's not going to be able to attend to a teacher. He's not going to be able to focus on friendships. We just want to nip it in the bud. And this is the reason that we're all early childhood therapists, because we want to start young.
It's so true. And I think that also when they're younger, I don't want to say that it's not a big deal, because it is, but it's very manageable and doable at a younger age, versus if we wait 10 years to address his posture and his core strength, it really could be dipping into so many different aspects of his life that it's kind of like a domino effect. It's just going to keep building up. And again, a lot of kids will solve it on their, will outgrow it, but a lot won't. So for Billy, in terms of his physical therapy and the things that I was looking at in his case, so his core activation and his sitting posture. If those things are not addressed, I wonder later on, how is he going to be navigating through the school environment? If he didn't have the proper strength development, he might miss out on, being on task with the other children in his grade, especially when he's in, older grades, if he's rushing to get from class to class, if he needs to carry a bag full of books, if he needs to make class on time, like once they get older and there's periods and classes to get to, he needs to be able to keep up. And then what about gym? I wonder how he would be integrated into, sports in school as part of his physical education. Is he going to do more after school sports programs with his friends? What if he gets chosen last to be on the team because he can't keep up? So that's a very big social component that we really can't just ignore. That can become a very big problem later on. And then even his posture, again, we don't know why he's leaning on the bookshelf, but as children develop and get older, especially when they reach adolescence and after puberty, their posture changes so much. And if something wasn't addressed early on, who knows what could happen in the future. And again, we don't know what will happen later down the line, but it's, again, important to address it early on so we can, like Evelyn said, so we can just take care of it from early, and then it doesn't have to become a bigger problem later on.
Right. So am I cutting you off, Laura?
Yeah, you just cut me off.
Sorry, go ahead.
That's okay. Don't worry. Okay. So as they were both saying, when most kids, a lot of kids can outgrow some of this stuff, but the earlier you receive those services, the better. It's the more beneficial for your children. And from the speech perspective, if he didn't receive services early on, in 5 years from now, potentially some of the problems that could arise, like Renee was saying, the social piece, right? So he's going to have a hard time with his friends. If there is an underlying social component going on, he'll have difficulty interacting with his friends, interacting with his peers, and just in general, that'll be difficult for him. If he has problems with problem solving, that will lead to more issues later on down the line in real life scenarios. As a child gets older, they encounter so many different things that they need to learn how to problem solve on their own. And he needs to be equipped with these skills. If he has trouble, he might have trouble with reading and decoding or reading comprehension, and that's going to hinder his school performance. If his expressive language and his intelligibility, if that's not addressed early on, he might have problems with his articulation. He's going to have problems expressing himself, expressing his emotions, and that could potentially lead to a lot more difficulty as he gets older. And all of those things combined can just lead to a lot more problems. And there's so much help here for them that if we can nip these things in the bud early on, the earlier, the better. And again, we don't know what problems will arise, and this is all fictional. But when you look at Billy as a whole, there are a lot of things happening, and we want to take care of those problems earlier on.
So that was basically just, our perspective of what might potentially happen. So again, I can't reiterate this enough, but we just want to make it clear that this was a very made up case based on things we've seen. And then we kind of wanted to brainstorm and think about what could potentially happen in the future if some of these things about Billy were not addressed at the time that they were suggested by, let's say, the teacher or whoever made the suggestion for him. So from, I think, all of our perspectives, we just saw that he had trouble concentrating in class. He had trouble keeping up with the kids in his grade. He had troubles, concentrating, staying focused. And then there's also the social component, just staying socially involved with the children in his grade. These are all potential problems, but again, we just want to make sure that, that it's just potential and it's not actually one equals the other.
Right, absolutely. So don't panic about having one delay or one red flag. It's all about getting ahead and preventing an issue later. So preventing an issue so that later things don't snowball out of hand. so I'm sorry, I'm checking the chats already, and I see one of your questions is, how do you know? And really, you need to, first of all, pay attention, trust your gut. So if you see something that doesn't seem right, say something, ask a teacher for more details, but often the teachers will come to you and say, this is not seeming right. And we want to evaluate your child for X. Sometimes X is a speech delay. And after the speech evaluation, that speech evaluator may recommend PT or OT evaluations as well. And they're seeing things, if you end up getting, if your child ends up getting services for OT or PT, it's because that evaluator saw something. So take those services, even though you thought, really, I just want articulation, I just want help on articulation. They're seeing something there, and they want to make sure that the same way that we're all making sure that that there are not extra underlying issues that are preventing a whole bunch of things. We're trying to lay the groundwork and the foundations for in the early years so that they have the ability to succeed, right? So the more layering and the more older they get, the more difficult it becomes to fix these things early on. So just really trust your gut, trust your teachers, trust the school. Don't panic if someone's telling you something. It doesn't always mean that like the world is about to explode. It's just that we want to make sure that we're addressing things early.
So, you hear, okay, so we explained all these different things to you. We explained the case of Billy, potential problems that could arise. So should you get your child evaluated? I see a lot of questions are coming in. Should you get your child evaluated? Absolutely. If you are not sure about something, if you have concerns, reach out to the therapist. But yes, get your child evaluated. It is free. In New York, it is free. New Jersey is a little different, but in New York, it is free. It's easy. And now the process is happening a little bit quicker. Ask questions. There are so many people who are here to help you. Reach out to one of us. Reach out to Search. Reach out to your pediatrician, your teacher. Any of us are here to help you. So also be on top of your agencies. Once you get your child evaluated, follow up with the therapist. Even when you get your evaluation, ask the therapist who's evaluating your child questions. Find out what it is that your child is having difficulty with, and potentially what they can do even between the evaluation to a meeting and starting services if they get approved, and find out what you can do to help your child. Once you get approved for services, follow up with your related service coordinator. If your child is in school and you want the services done in school, your related service coordinator is the one to contact. They know which therapists are there. They know which therapists have room on their schedule. They know which ones match up with your kids. So be on top of them. You really want, if you can get the services in school, obviously there are times you want it done at home, but if you can get your child services in school, reach out to your related service coordinators and make sure it's being done in the school setting.
So once you do get matched with a therapist, which a lot of times takes a really long time, but also today doesn't take so long just because of everything that's going on. Things are happening much faster. Once you do get a therapist, the most important thing is to make contact with that therapist, get in touch with them, get their number. And I think the most important thing you want to ask them is, what did you assess with my child? What do you see is going on? And what are you going to work on with them? And then you can even take it one step further and say, how can I help at home? Because again, the services that are provided are so little. It's, most of the time, I can't say this for every child, but I feel like, the majority is usually 2 times a week for 30 minutes. So it's really an hour a week of therapy, which really is not a lot. So if you can ask the therapist what you can work on with the child at home, it just creates this beautiful carryover that can really just reinforce everything that we're doing in the session. And then the most important thing is to keep up with the therapist, keep contacting the therapist, staying in touch, communicating with them, and asking them, how's my child progressing? Is there anything I need to change? Anything I need to look out for? Just, maintaining that communication is key. It's very, very important. So I know a lot of you are asking questions about how to get evaluated, when to get evaluated. So I'm actually gonna give the floor to Miriam now. She's gonna tell you a little bit about how search works in terms of reaching out to them and getting more information on getting evaluated.
Okay. Hi, I'm back. Okay. And this really worked out pretty well, this whole thing. Okay. I'm kind of excited about it. Thank you, ladies, very much for your help. And really, I hope all of you participants are kind of, lapping it up because there's so much here. And a lot of you moms are asking some really good questions. I want to address a couple of them. Somebody said, what is early? What is too early? What do I do? And even somebody asked about holding a child back. Okay, so what we do at Search is we help you navigate the process. In EI, which is 0 to 3, and CPSE, which is ages 0 until the child turns 3. CPSE, Committee on Preschool, is ages 3 and 4. Those are done by agencies. We have a list of agencies that are excellent. And you can go to any agency that you choose. They will come to you. They will evaluate your child. They're all professionals. They are all degreed individuals, very much like our young participants here are professionals. And even our professionals here know how to evaluate children, and they can, based on norm-based tests, they can tell you whether your child is on level with his peers, behind, or above. When a child is behind, we want to get them some therapies. They will do, when it's CPSE, when it's EI, they will do all the evaluations they feel are necessary, and then they will make recommendations. When it's EI, you meet with a specific team. When you move into CPSE, it's another team. And the beauty of EI and CPSE is that the agencies really handle everything. We do get involved whenever we need to work, whenever parents feel the need. We also sit with parents and review the evaluations. We can translate that gobbledygook into real stuff that you will understand. We draw maps for you. We draw pictures. When you walk out of our office, well, now you're not coming into our office because of COVID. Our offices are closed, but we're working with families all the time. And when you leave a Zoom meeting with us, you have a very clear issue of what your child needs and what the therapies will do for you. Somebody asked how early is too early. I'm going to emphasize, I think was it Laura was the last person who said that, or maybe it was, I don't remember, Renee. Listen to your gut. I'm a firm believer in Binaya Tera. Women have an understanding, an extra understanding. They know, God gave you a gut feeling. You know when something's off. You look at your child compared to other children and you see, is your kid like those kids or is he a little different? Is she working alongside or is she playing with? What's going on? You have a gut feeling. If you have a feeling that something's wrong, listen to your feeling. And that's really, and obviously if teachers tell you, your child is not keeping up with everybody, your child has a problem, look, if your child was tugging at his ear or she was going like this or coughing, you would take your child to the doctor to see what that was. Sometimes it's nothing and sometimes it's something. So we need to rule it out. I had a list of things I wanted to talk about. Getting services, as I said, is pretty easy. Also, the professionals here talked about getting ahead of the game. I'm going to tell you what happens when you don't, okay? Because we get parents who come in 2nd, 3rd, 5th, 8th. My kid hasn't been accepted to a high school. He's been getting services, or he was supposed to get services, and now he won't. And now it's too late. We get those things all the time. And every so often I'll be talking with a parent who's trying to get their kid even into a kindergarten, even into an elementary school. And I'll talk about what's going on, and they'll have a whole bunch of evaluations to give to me. And I'll look through this and I'll say, wow, it looks like your child really needed speech therapy and occupational therapy. You didn't get that? And they'll say, no, I didn't want it. And I'll really feel bad because now I can't fix the last 2 years and I can't get that child into a school. It does really hit later. It really does come back to bite when a parent doesn't follow the directions, also follow the recommendations. There's something else you need to know. And that there's been a sea change at early intervention and at CPSE. There was a time when you walked in and you said, I want evaluations, and they just shoved everything at you. That is not the case anymore. There are parents who are dying for services and they can't get them because their kid doesn't hit the mark. So if the Board of Ed in preschool, or if early intervention says your child needs therapy, trust me, your child needs it. They are not giving it away anymore. Those days are long gone. I'm going to take a look at the chat. Were there any, there was someone who asked a question about, and the child sounds a lot like Billy, okay? Getting services, but not in school, virtually, and that's a whole other topic, virtual services right now. And that person asked, does it pay to hold the child back? Okay, that is a really individual question. And that's not something I can answer here. And I don't think any of us could. I'm sure you guys have stories about kids who needed to be left back and weren't, and who were left back and didn't need to be. It really is individual. It really is individual. Sometimes it's the right thing and sometimes it's not. Can I ask you ladies to do something for me? The one thing that I really love about what you do is you talk about everyday things that parents can do in their regular, not therapy, but everyday things that parents can do that can really maximize their child's potential. And it doesn't involve special equipment and it doesn't involve anything. And I wonder if you guys could talk a little bit about that.
Sure. Can I start?
Please.
Go ahead.
I just want to say, this is so easy to give them, but turn off the devices, please. I do it too. I have 4 children, but we're not doing them a service. And give them sensory experiences, put rice in a bin, let them play with it, give them shaving cream in the bathtub, let them mush it around the walls, give them activities that are strengthening, let them help in the kitchen, make khali with them. That's really great for finger strengthening. Just anything that you're doing, let them help, right? So my kids unpacked all my groceries tonight. That was strengthening and it really got done very quickly. So it's just teaching them how to help, strengthening them in the process, letting them feel that independence and usefulness. And it really could, I know it's not easy in the beginning, but once you get into a rhythm of that, it's really helpful to everybody involved.
So
Go ahead.
I'm gonna.
I really wanted to talk about I don't know if anyone saw on me and Laura's Instagram, but we recently, just last week, we went to Dollar Tree together. I don't know if this is what you wanted to say also, but it really just relates back to this idea of the device. Cause like, I know for my kids, it's really incredibly hard to take away the device. So like, I know that I need to do it, but it's really hard, especially because my older daughter she has a very big understanding of what the iPad is and how to communicate with her friends and how she needs to use it to study with them and do projects with them. So we went to the Dollar Tree and just picked up like some different arts and crafts. And I mean, I did arts and crafts. Laura got more like things for her boys, but I just noticed when I gave them, when I set it up on the table and I just had it out for them, my daughter ended up using her iPad for very little that night. So for me, I think if you just know what your child's interested in and kind of make it more available to them and more accessible, it's much harder. We live in a world now where you actually have to really put an effort into thinking about how to get your kid, let's say involved in physical activities or even just coloring now, like where coloring used to be such an easy thing for them to do that they wanted to do. But now because the iPad has become such a big thing in the home, it's not so easy to just take out a coloring book. So I personally feel like as long as you're taking out things for your child that they're interested in and things that maybe they don't even know how to do yet, like me and Laura spoke about, let's say using a jump rope for even a child who may not know how to jump rope, but just having it out and having them exposed to something like a new skill or a new game, I think can be very beneficial.
So I just want to also follow up with what they both said. So like what Evelyn was saying, getting your children involved in the kitchen, unpacking groceries, any of those things, it's, first of all, yes, it increases their independence. I think kids should be involved in helping. I always talk about quality time with the kids. It's very difficult if you have 3, 4 kids, even if you have 1 or 2 kids, if you're working, if you're busy, especially this last year, Corona, the kids were home for so long. I mean, my kids were quarantined so many times, and my kids need that quality of time with me, but I don't always have that hour to spend with each child. It's just not realistic right now. So even doing something like cooking with your child, making a salad with your 4-year-old for 10 minutes, or sitting down playing blocks for a few minutes with your 2-year-old, or, just having a conversation before bed with your 10-year-old. Those little moments you have with your child, that's a perfect opportunity to bond, talking about your day, increasing their language skills, their narratives, their sequencing, depending on their age. Like Evelyn and Renee were both saying, anything that that incorporates also the fine and gross motor skills. So the jump rope, the unpacking of the boxes. Renee and I spoke about this in depth on our Instagram Live a couple of weeks ago. Chores, get the kids involved in the chores. Now, I just want to go back a second to the electronics, because I feel like this is a big one in the speech and language field. I've always been that mom that there were no devices during the week. It was just like a hard and fast rule in my house. My kids knew that. Now, when Corona hit, that was not realistic. And for a while, even when they were steadily in school, they still came home and wanted the TV or wanted the devices, even my 3 and 6-year-old. And I realized that because they expect it, they're going for it. They've had it, they're going for it. So I made it a rule with my younger 2, especially. They come home at, let's say, 3:30, and I prepared them for it. We are not turning the devices on. We're coming home. You can play. You want to invite your kids to play. Like Renee was saying, have those things out for your kids. It doesn't have to be anything crazy. Take out a few toys, a few games, a few books, anything very, very simple, nothing crazy. You don't want a crazy cleanup, and just leave things accessible to your children. I hear a lot of moms who tell me they either have a million books and a million toys and a million this and a million that, and they can't handle the mess, and their kids are getting overwhelmed. Keep it very, 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 very simple. Only a few things, but keep it accessible to your children. If you set a time for everybody to read together, 15 minutes, 20 minutes a night for reading, or, if you want to give them the devices, set limits. That's the important thing. You are the parent, and you are the one who controls what goes on in the home. Give your children choices about what they want to do, but you set the tone for the home. So whether it's mealtime, or it's reading time, or it's bath time, every little thing that you are doing with your child provides an opportunity to speak to them, to bond with them, to work on following directions, to have them help you, and for them to develop their independent skills. So I think that's just like something to keep in the back of your mind as a parent. Whatever you're doing and wherever you're going, you can involve your child in that process.
I want to mention, I read an article once about this woman who decided that it was time for her 12, 13-year-old to start helping. And so she asked her to load the dishwasher. And then she looked in the dishwasher and she saw what the kid did. And she said, oh my God, like she doesn't even know how to load the dishwasher. And her husband looked at her and said, well, did you ever teach her? Like she, all the dishes were stuck together. There was no way the water, and she had no idea. And it dawned on the mom that she had never actually taught. And she was saying like, hey, isn't it about time these kids know how to do this stuff? Guess what? They do not learn by osmosis. They just don't. When babies are little, they open your drawer, they pull everything out, they put everything back in. Why are they doing that? Why are they they're not making a mess. They're not making a mess. What they're doing is they're learning. They're learning. I'll never forget my daughter, who has been teaching for 20 years. Okay, when she was a year old, we lived in Israel, and eggs came on a tray. And somehow I had left the fridge open, and she walked over to the fridge. She took this round white hard thing, dropped it. She looked down, and it was all this mushy gush. And then she did it 4 more times. And it was just so exciting to her. I was a young mom. I had no idea that she was learning. She was learning. Now I see my grandkids do it, and my children say, Ma, they're making a mess. No. That's your child learning. Watch the wheels turning. If your child doesn't have those experiences, they'll never learn. If you don't teach your child, to put things away, to make a peanut butter sandwich, to do the things your kids, when they're young, they'll actually like to do it. When they're a little older, they're going to fight you every inch of the way.
Absolutely.
But when they really get older, they're going to come back and say, thank you, Mom. Thank you, Mom. I'll never forget my daughter who went to Israel and came back and said, Mom, I was flabbergasted that a girl in my apartment put her cashmere sweater into the washer and the dryer. And she had a beautiful American girl outfit when she was done. Because it shrunk. She had no clue. And my daughter actually thanked me for teaching her to do the laundry when she was 13. So all of the things that our professionals today told you to do now when your children are little, they are going to strengthen them to turn into self-sufficient adults. It's really important, those things. Do we have any other questions? Come on, I'm looking to the chat. I don't see. Okay.
There was one question. I don't know. Someone wrote, why pull the child out of class?
Yes, yes, we didn't address that. Yes.
So I do strongly believe that therapy can happen in the classroom. It doesn't always need to be a pull out session. There are situations that we want to work on something more specific and we will pull out, but we often push in because like we were saying before, that's the way we get to see the child in their natural environment and see all the things that come into play with everything that they're experiencing. So push in, and you can tell your therapist, I really would prefer push in sessions as much as you can do that. It's helpful for the teacher to understand what you're working on. It's helpful for you to understand what the teacher sees and what she's having difficulty with. It's helpful for you to see everything that's going on between the child and his peers and his interaction with the natural environment that he's in. So I think it's a good question. And I think you're right that playing in the classroom and witnessing that is an important piece.
So I just want to build on what Evelyn said with addressing that question. Yes, pushing into the classroom is a huge component. It's a huge thing. That's seeing them in the most natural environment. But as a parent, I just want all moms, all of you parents to take away that if your therapist tells you that it is necessary to have the pull out, there's a reason that they're saying it. I know that as a speech therapist, if I'm working with a child, let's say a 3 or 4 year old on articulation or phonological processes, so how they're speaking, their intelligibility, their clarity, it's very hard to jump right into the classroom and do it that way. A lot of times I need to pull the child out, be one-on-one. It needs to be quiet so the child can focus on me. And we want to work on that skill first in that one-on-one setting. Then maybe bring a friend in and do it like that in a group setting, and then push into the classroom and help translate over and carry over those skills that that child was now taught and push it into the classroom. So that is a key thing to think about.
I want to also say something. This is so minor, but also I know for myself, when I pull the children out, I really try to do it when it's not an important time. And I'll also, when I meet the teacher for the first time, I'll preface it saying, when's the best time for me to pull him out? When is, the most downtime? Because really, if it's kind of like a free playtime, I'm basically doing, what I'm doing with him in the hallway is what he's kind of doing in the classroom. And like Evelyn said, a lot of times I will push into the classroom setting based on, it also has to make sense with what the class is doing at that time. But I really, and I'm sure Evelyn and Laura know, we really try to do it at times that are not focused on learning, or if they're doing something important with the class.
Absolutely, you're right.
Yeah.
So there's a question in the chat that I saw. How early is too early for early intervention? The MCHAT is done in 18 months, but can we get our kids evaluated at 12 months old? So I just want to address part of this, and I'm sure, Miriam, you have a lot to add to this, and you guys also. When you look at a child's skills, first of all, if something is not, like we said before, something is not sitting right with you, seek out the service, seek out the evaluation, ask the expert. Now, you can get your child evaluated at 12 months old. Nobody's saying you have to wait till 18 months. The problem is that sometimes, very often, you get them evaluated and then they're not approved for services because, unfortunately, the way the system sometimes works is your child does not have enough of a delay to get those services approved. But there are therapists who will do private evaluation, private services sometimes, and that might be what you need. Or your child might be okay. That's why it's really important to speak to a professional if you're not sure.
Right. Also, there's a question that just came in now. Again, some of these questions are a little bit too specific because we're not actually looking at the child. But again, like Laura's, like someone mentioned about her baby that's not moving yet. If you feel like something might be up, it does not hurt to get evaluated. You lose absolutely nothing getting the evaluation. And again, as early as you can see something and you feel like something's not right, just ask questions. It doesn't hurt to ask. Even, okay, if you don't want to go straight to get the evaluation, ask your pediatrician, reach out to one of us and say, hey, what do you think about this? There's so many mothers that will ask me questions. And the truth is, I really try to help as many people as I can, really, because they'll say things like, oh, but my kid's doing this and I'm really nervous. Should I be worried? Sometimes maybe yes, and maybe we should go further than that. And sometimes maybe no, but I think, Baruch Hashem, we have so many resources within us and within our community to try and seek out help. It doesn't hurt to ask.
Yes, yeah, I wanted to add on that. Generally, the pediatrician is the first line of defense. But there are a lot of the EI agencies that have, and you can even look this up online, it's very simple. What are normal developmental milestones? And the developmental milestones are not carved in stone. There are ranges from this month to this month. That's what you look at. Some pediatricians are very laid back. Don't worry, he'll get over it. I'll never forget one pediatrician who absolutely refused to write an OT script, which wouldn't have affected him at all. It just was going to the Board of Ed because he thought that I was crazy for thinking that the child may have delays. It was fine motor, it was sensory, and some doctors are a little more evolved and some are less. If you feel something's wrong, or if you look at your child compared to other babies or other children, that 8-month-old, if that 8-month-old doesn't look like other 8-month-old, you really lose nothing, especially in EI. You give them a call, they come running down and they take care of it for you. And if there's a delay, there's a delay. And if there isn't, they may say, you know what, there's a little bit of a delay. Why don't you come back in 3 months and let's do this again? And let's see, is your child moving up, or is everybody moving up and your child staying the same? If your child is staying the same, then that child may warrant services. There was another question that actually came to me, and that was, what if working in a sensory gym is more beneficial? So that actually is a question that comes up, and it really would be interesting to hear. OT in a sensory gym. Okay, so I guess
Right.
that would be Evelyn. Yeah.
Yeah. I mean, there are times, it really depends on the child. It does. Like Renee was saying, there are times that it is more beneficial. There are times that we can figure out how to provide sensory experiences in the school, that being that there's the school setting, it plus the sensory that we are able to give, like a lot of therapists have. I have a dizzy disc, I have a trampoline, I have a tunnel, I can't even think of all the things I have right now, but I have a million sensory things that I have without having a sensory gym. So yes, sometimes certain children really do need a gym, but then there are other times that what we can do is enough, especially because that added piece of having that full picture of school is so beneficial.
Right. I also want to talk about the difference between EI and CPSE. EI is home-based. Your therapist comes in twice a week for 30 minutes, and she's with your child twice a week for 30 minutes. That's one whole hour out of, okay, I don't even know how many hours there are in a week. I know that, there's that song with all the minutes, but you're with that kid all the time. And really, EI is the therapist coming and showing you what you should be doing. And it's not necessarily even exercises, but it could be just everyday things that you could do with your child in order to help that child improve and maximize his or her potential. So EI is home-based, where you, the parent, get to do a lot of that stuff. And you should be there with the therapist, and you should learn how to do those things and find other fun things in the house to do with that baby so that that child can progress. CPSE is school-based. So that's when they also try to show the teacher, and you can also do homework at home, but you have to seek that homework out. Not every therapist is going to tell you what you should be doing. So you want to work with the teacher, with the therapist, in order to know what else you can do at home to help your child.
Absolutely, because it doesn't change the fact that the parent still needs to be really involved just because it's in a school setting.
Right. So someone said, but do you take kids out to play with sensory toys or play inside class? And I think that would probably be very individual, right?
Absolutely.
Yeah.
Now, just because your kid isn't getting sensory stuff in school with their therapist doesn't mean you can't take your kid to a sensory gym for fun. There are a lot of places to go.
Right.
And, some kids, some kids go home and we don't have a trampoline, go jump on the bed 50 times. Can you count to 50? Those are things kids can do. You don't need any special equipment. You may need to buy a new mattress, but you don't need special equipment.
You could set up obstacle courses. You could use your couch pillows. You could, there's a million things. You can put blankets over chairs and then that you go under it. That's your tunnel. My daughter, my 5-year-old started making up her own obstacle courses now, and they're ridiculous. But now she just understands this concept of an obstacle course because that's what I do all day long.
And you could throw in the language components in there, under, over,
right,
between, all those different things. So I have someone sent me actually a direct message question. I think this might be one of the last ones. What do you think a small class would benefit a 5-year-old who educators believe he most likely has auditory processing? How do children get the attention they need in a 1920 student classroom with auditory processing disorder? So that is, like everything else, very child specific. Auditory processing is usually diagnosed a little bit later, but I guess if the child is demonstrating characteristics of auditory processing, I think, yes, that child would benefit from a smaller classroom. There are so many different factors to consider, including all the, the outside noise that's happening, how the teacher is interacting with the child. Is there an assistant in the classroom? What kind of services is the child getting? But if you suspect your child has auditory processing, my recommendation might be to look at those smaller settings.
Right. When you look at a small class, you really want to see that the children have the similar issues as your child, that they're basically on his level, not significantly below and not significantly above. Okay, somebody sent a very nice thank you, but I just want to go around the screen and ask, we'll start with Renee, then we'll go to Evelyn, and then we'll finish with Laura. What would be your last message to our moms and possibly dads? Maybe there are dads there. What would you want to leave our families with tonight before we close this program?
I really just want to say, first of all, thank you so much for giving all of us this opportunity. I'm really just very passionate about just bringing awareness to everyone and just helping everyone get more information about what they can do to benefit their children, and even for the adults that I work with, just what to do to benefit themselves. I just really feel like with the knowledge that we have now, we can do so much. And I think that there's this concept of like, oh, but when we were kids, no one got pulled out of the class and got services, right? And I totally hear that, but like, how great is it that we have so much information now about PT and OT and speech and all these awesome things that we can give our kids? And I just feel like, why not, So if there's anything I really want to say is that all the things that we can do to help your child can only benefit them. And I hope that this conversation took away some of that stigma of a delayed child or a kid that needs extra help. It's not about delays or help. It's about helping them get to be the best that they can be. Like, let us help you bring that out in the child. And I just hope that it's more of a positive feeling now, more of a positive vibe,
Oh my God, Renee, you inspire me. You took everything that I would love to say, but that's so beautifully. And I just want to add that, like, exactly, I don't have anything to add. Just like Renee said.
We all feel the same.
Yeah, we're here to help. If you have any questions, please don't hesitate. We just want what's best for all of you and all of your children. I know it can be overwhelming, so we just wanted to help in any way that we can.
So Just guys, both of you beautifully spoken. I want to just echo, thank you, Miriam and Sari and SBH for giving us this opportunity to come on this platform and, you know, share some of our knowledge with everyone. And thank you everyone for tuning in. I agree with both Evelyn and Renee. You know, very often we hear that stigma of therapy, but you know what, as a parent, and this is the biggest thing, we want to help our children strive to succeed. That is our role as parents. We want to be a role model, and being a role model means asking for help when it's necessary. You know, helping our children when it's necessary, giving them the tools. We don't want to do it for them. We want to provide them with the tools to help them succeed in life. And I think it's a very important lesson to take away from this. And just don't have a negative thought process about therapy. It's a positive thing. We're here to help. We're here to provide you with this information. And like they said, you know, our biggest thing is to see everyone succeed. And we're really just here to help. So if you're not sure about something, reach out. We love to help. We love to see progress. We love to see, you know, we love to see that click and that light that happens when our clients make progress, or a parent takes what we say and helps their child. So if you're not sure, go with your gut and reach out to us if you have any question at all.
Right, and I put your tags in many times over the course. I really want to thank this fabulous panel of our own homegrown therapists. These are our community women who have have pursued education in order to help our families and our children. And I feel like I'm your mom. I'm so proud. It really is wonderful to see what you guys do and how passionate you are about your work. And I want to thank you, all three of you, for spending the time. You did a ton of prep for this program, and we thank you so much on behalf of all of the moms and dads listening. I want to thank you on behalf of SBH. And ladies and gentlemen, those of you watching, please feel free to reach out to us. Anything we can help you with. If we're not able to, we'll know where to send you. Okay. So I'm going to say goodnight to everyone. Thank you all for joining us. Okay. And we'll see you now. Oh, one more thing. Eventually, I don't think it's on the YouTube channel yet, SBH YouTube, but we had a fabulous program last week on devices. Are we raising robots? And it had to do with how to manage technology. It was a really, really great program for all ages, certainly for young children as well. So I encourage everyone to watch the YouTube channel. This will also be on the YouTube channel. Please God, I hope we recorded it okay and it works.